Namaskaram. In this video we shall see how can doctors write a research paper. Why at all is it essential to know this? Because it has become a mandatory NMC criterion for eligibility for postgraduate exit exam. A certain number of publications is an essential criterion for academic promotions. It is a DIY, that is do it yourself method of learning. See, once you've passed your post-graduation and are out of college, and a patient with something unusual or a tricky diagnosis comes to you, now you are in a fix of what to ask, who to ask, especially if it is not there in books. So, research can help you find an answer to this. Besides, original researchers reviewed systematically paved the way for meta-analysis and formulation of guidelines and recommendations. So, scientific papers are of two types: review papers and research papers, which include case report, case series, original research articles, and original research papers, which include research briefs and short communication. Case reports report something new or unusual in a single patient. When more than one patient presents with similar findings, we call it a case series. Original research is conducted on a larger number of patients, and manuscripts which are shorter than original research articles are called as research briefs or short communication. Besides, meta-analysis and systematic reviews are a review of various researchers analyzed statistically to form a composite conclusion or recommendation. So they are in between the review papers and research papers but are counted as research papers. So after you have done your research, you can present the entire process along with the findings as a poster presentation, which is done in various conferences, paper presentation, again done in person or virtually, or as a publication in which you submit your research to a journal for wider readership. So for all the above three, you shall have to write a paper. So knowing how to write a paper is actually very important. At post-graduation level, you must know difference in the steps of writing a thesis and a paper. Practically speaking, there is no difference, but a thesis comprises of the following 8 steps: introduction, aims and objectives, review of literature, methods, analysis, results, discussion, conclusion, and also the summary. Whereas the headings in a paper are introduction, aims and objectives, methods, which include statistical analysis, results, discussion, and conclusion, and also an abstract is written at the end. Actually, both the thesis and paper are almost the same, and the review of literature of a thesis is utilized in writing the introduction and discussion sections of a paper, while the analysis section is sometimes included in the methodology section of a paper, or it might be written separately as demanded by various journals. Whatever be the two, there is a mnemonic called as IMRAD, showing what should be the natural flow of writing a research work. So I stands for introduction, M for methods, R for results, D for discussion. This should be the basic flow of writing a research paper, be it a thesis or a paper, irrespective of the headings allotted. So the first step of writing a research paper is introduction or background, which answers the question why. It introduces the topic as to why it is interesting, how important it is, and why does it need research. Now suppose we wish to study the role of a particular drug X in ARDS in children. So you may like to define ARDS in children and its impact in terms of mortality and morbidity, showing how important it is and it does need research. Next, what do we know about it till date? Maybe 1 or 2 studies, and a part of the review of literature can be helpful in writing this section of this part of the introduction. So in this method you can write the treatment options available as per all the research which has been conducted till date in this field. Next, what is the knowledge gap or lacuna? That is why your study is needed. So this will come if by saying there is a lack of definitive treatment options because you have already cited the examples above, the references above, and you finally conclude that there is a lack of definitive treatment options in children. So basically points 2 and 3, they help in defining the lacuna in the knowledge. Then finally you tell how do you intend to fill in the gaps by your research. That is the objective or purpose or hypothesis which you are going to work upon in your research. So basically you will be talking about the probable role of the drug you wish to test. So this is how you write the introduction part. Whatever be the content, you must remember that introduction should always proceed from a more generalized format, that is talking about the topic, to a specific format, that is talking about your aim as to why to conduct, what to conduct in the topic, from broader to narrower, so that the reader must have an idea of where the paper is heading to. Some authors opine that introduction should be written in the end, but it basically depends on you. In fact, many of the authors have said that introduction be written in the end, but it entirely depends on you and your comfortability. The next section is the aims and objectives, which answers the question what. Aim is basically what you want to achieve. That is your basic intent. And objective is what specific things you plan to do to achieve your aim. It is not method, it is a kind of objective. For example, your aim is to study the role of drug X in the management of children having ARDS. Now, how will you study the role of drug X? Objectives will be you will first compare any change in FiO2 before and after giving the drug X, assess the final outcome of patients being given the drug X, any drug X related adverse effects, and then you will compare the differences in FiO2 outcome and drug X related adverse effects between the case and the control groups. Okay, so aims tend to be more broader, that is generalized, versus objectives which are more specific. And you must remember that it is not always essential to have objectives if your only objective is to achieve the aim of the study. One must remember the mnemonic SMART. That is, your objective should be very smart. Smart means they should be very specific. Okay? Measurable, accurate, reliable, and reproducible. Reproducible or reliable means that they can be repeated again and again, and the objective should be time bound. Time bound means they can be achieved in a particular time which you have set for the completion of your research work. Now, coming on to the methods section. This section answers the question how. So basically it is the longest section. It is a record of only and only all that you have done and not discussing any kind of result at any cost. One should be absolutely clear, and the methods should be such that they are reproducible. That is, they can be replicated by anyone else who performs it step by step. See, if your methods are new, provide all details to repeat the study. If you are using an old method, give the name and cite its reference. One can use an algorithm or flowchart to show the methodology if required. Methods pave the way for analysis and result, and it is understood that one must be humane while doing the research and must be clear and explicit while publishing it. In short, the methods must include the type of study, that is whether observational, experimental, prospective, retrospective, etc. Place of study, duration along with the time period, that is if you specify 1 year, then you have to specify from which month, which year. For example, say January 2020 to December 2020. So this will be 1 year. Then sample size, you have to mention inclusion exclusion criteria, standard definitions criteria along with their references, and protocols, procedures, and manufacturers. Along with this, you also should mention how did you take the informed consent, whether it was written, it was verbal, and you need to keep a proof of the same in case it is required further. A statement on ethical clearance, How and what will you do once the patient satisfies the inclusion criteria? Like once the patient has been admitted, you see that he fulfills all the criteria for inclusion in the study. How will you proceed next with the patient? Data recording, how will you record manually and how will you enter the data in the software? Which software and what statistical tests you'll use? What value of P will you consider significant if your results come true? Now, an international initiative called the Equator, that is Enhancing Quality and Transparency of Health Research. It is a network which gives guidelines and checklists for reporting research. For example, CARE guidelines for case reports, STROBE guidelines for observational studies, CONSORT guidelines for RCT, START guidelines for diagnostic accuracy studies, and PRISMA guidelines for meta-analysis or systematic review. Now, results should be written in a specific format. The first thing which should come is the descriptive data. For example, age, gender, mean respiratory rate, values of oxygenation index. In the example which I have given, I'm talking about all that. How many developed side effects, etc. And you can include algorithmic representation of patients in a diagrammatic form in this section. The next part which you need to describe is the analytical data, that is calculation, relation, cause, effect, etc. For example, in this study, if there is any change in oxygenation index before and after the drug X, and is the change statistically significant? One must use graphs and tables if required, and do not discuss the results at any cost in this section, because the newbies, the young residents, they often tend to do so. One must also avoid including all data and include only the relevant data. And it is not essential that results should be the largest section. Also, it does not matter whether your result is positive or negative. What matters is how you have presented the results. Now, table should include a title, what's in the table, a caption at the top of the column should be self-explanatory. Give units of measurement alongside the caption. For example, age has been recorded in months like 15 months and 20 months, and weight has been measured in kgs, for example 9 kgs and 11 kgs. All the elements of the table should preferably read vertically rather than horizontally. Do not present the same data in both tabular and textual forms. Residents are very tempted to, because they want to increase the number of pages in their thesis and in their paper. So they tend to present the same thing in both tabular and textual form, which is wrong. You may consider adding a footnote if you want to. Now, figures should have a legend explaining the figure and written below it. Always provide a reference to the figure in the text. Name the x and y axis and give the titles in the graph. Leave sufficient space on all the four margins of the figure, 2 to 3 centimeters each. And do not extend the axis much beyond the range of your data. For example, if your data extends from 20 to 80, do not extend the axis up to 200. You can maximum include up to 100 or 120. I think it has already been too exhaustive for now. So we shall discuss the remaining in another video. Thank you for watching and do share the knowledge.